Hello, my name is Connor Grady, and I'm an MPH candidate at the Yale School of Public Health. Today, I want to talk about my project, Tweets from Public Health Agencies and News Media Organizations during the first 3 months of the COVID-19 pandemic, a Twitter analysis. I have nothing to disclose. So Twitter is a powerful health communication platform with over 65 million American users. Twitter users are younger on average than the US population, but the distribution of gender and race is almost equivalent. Public health agencies use Twitter to disseminate health information and to prompt behavior change to improve health. News media organizations also use Twitter to spread information, some of which will include health-related information, especially during the COVID crisis. Our group wanted to look at the interaction of these two groups and how they influenced public discourse during the pre-pandemic period of COVID-19. Our research questions were: 1, during the pre-pandemic period, what was the sentiment of tweets from the general public, and did sentiments better match that of public health agencies or news media organizations? Our second question was: how did tweets content differ between US-based public health agencies versus international agencies, and US-based non-news media organizations versus international organizations? We approached this by first downloading tweets from the Twitter API from January 22nd to March 24th that were only in English and contained coronavirus as a key term, because this was the most commonly used term at the time to describe COVID-19. We then grouped those tweets into 3 categories based on accounts that we created beforehand. And then we ran these tweets through a sentiment analysis, which will assign each word in the tweet a positive, negative, or neutral label based on the Bing lexicon. And then the most prevalent label in that tweet will determine the overall sentiment. So this was the first analysis, and our second analysis was to split public health agencies into US and abroad, as well as for news media organizations, and then look at how the content differed between the two groups using n-grams, which are word pair frequencies. So getting into the results, for our first question, we looked at the positive sentiment of these 3 groups, and you can see the proportion of positive tweets on the y-axis. As you look at these 3 groups, you can tell that public health agency tweets were more positive overall, especially after late February. And the proportion of news media and normal user tweets that are positive were pretty low, but they were almost the same throughout the time period. Then looking at the negative sentiments, you can see that negative tweets were greatest among news media organizations and normal users, though they trended down slightly. Public health agency tweets were less negative overall and trended downward, especially in mid-February. We then looked at content analysis. So for US public health tweets, the most common bigrams were more related to preparedness and words like press briefing, medical conditions, preparedness measures, talking preparedness, daily precautions, were very different from the international public health accounts, which mainly focused on locations where cases were happening and were more update oriented. Comparing news media, they were a lot more similar, as denoted by less red font here. The only differences were more of here President Trump and White House, which are obviously a US context, but overall they were pretty similar to each other. So our conclusions for research question 1 is that public tweet sentiments align better with that of news media organizations. And this goes to show that the news media has a critical role to play in disseminating timely health information, which should be guided by and in concert with public health agencies. For our second research question on the content of these tweets, we found that news media topics were similar to each other in the US and international context, while public health agencies' topic varied more by location. And we noticed that international public health agencies tweeted more frequently about case updates rather than prevention efforts. These are some of the co-authors on the project from the School of Public Health and School of Medicine, as well as our collaborator at the University of Georgia. Thank you.